At the person at the drive fibrillation at the blood dry. Definition: atrial fibrillation and the common and the fault of the arrhythmia in the way that the rhythm of the regular in the heart.
Catheter ablation has emerged as an excellent, minimally invasive treatment option for atrial fibrillation. Our specialists are some of the most experienced in performing this procedure, with success rates among the best in the nation. They'll work with you to decide if an ablation is right for you. Doctors Patrick Chu, Brian Baranowski, and Walid Saliba will tell you more.
For those patients where medications have not been able to control their atrial fibrillation, obviously their lives have been affected. Some patients can be very symptomatic with atrial fibrillation. It can interfere with their ability to do daily activities. So ablation as a means of controlling and settling down this atrial fibrillation can vastly improve those patients' lives.
We know the initial trigger, the initial spark or the initial firing for atrial fibrillation tends to come from the pulmonary veins. And these are the four veins that are draining blood that has just gone through the lung and picked up oxygen back to the left side of the heart so it can then be pumped everywhere it needs to go. There's little muscular sleeves that line those veins, and those muscle cells, for whatever reason, in select individuals can act in a very irritable fashion where they fire very, very rapidly. And that tends to serve as the initial spark that sets people off into atrial fibrillation, shorting out the entire chamber. Medicines, when we use them as an approach to the management of atrial fibrillation, try to calm down that irritability. When the medicines are ineffective, and we're going to take the patient to the next level of our therapeutic approach and go for an ablation procedure, what we're doing is burning or ablating the tissue around those veins to ultimately turn that tissue over into scar. Scar doesn't conduct electricity, therefore if there's electrical firing within the vein, that electrical firing can't exit the vein and short out the entire chamber.
So essentially, a catheter ablation is similar to a heart catheterization, which most patients are.
Application in your obesity over the hypertension and allows the sick and the common result of the grazing and the something of the breathing in the source.
There isn't much that slows 81-year-old John Kosovar down.
As you grow in age, doesn't mean you'll be less active.
A few years ago, John noticed his heart was beating out of sync.
The heartbeat can go up to 100 some, 130, 140, maybe even higher. And I didn't find it real pleasant.
John went to Cleveland Clinic and was diagnosed with atrial fibrillation, also known as AFib.
The heart basically has irregular beats, and people experience it with the symptoms of palpitations, tiredness, and they can develop heart failure or the most dreaded complication, stroke.
People with AFib have a 5-fold increase in stroke risk due to blood clots that can form in the heart and travel to the brain. To reduce that risk, John was taking blood thinners, but they made his blood too thin, and then he fell.
At the emergency room, I was telling the emergency doctor, and he told me, he said, "You were lucky." He says, "because if you would have hit your head with the blood that thin, you could have had a massive brain bleed."
John's doctors determined he was a perfect candidate for a unique heart device called the Watchman. It's designed to reduce stroke risk and potentially eliminate the need for blood thinners.
It's an umbrella-shaped device that can catch the clot and prevent it from going to the brain.
The device is inserted through a vein in the leg and secured in an area of the heart where clots typically form.
The clot is trapped basically behind it, and it's resorbed by the body.
John feels great, and he's still working 40 hours a week, although he does plan to slow things down, eventually.
There'll be a day that I'm going to join my wife in retirement.
The pros and cons is the count delay at the door, the victory at the reform historically, at the road clock, at the hill, at the flower rate, and the all duplication, and the rare alcohol, and the consumption Stimulant way and the way and the can which her address at the fibrillation at the wheel.
It's a pleasure to welcome you here in Innsbruck in our EP lab of the Medical University. For today, we have scheduled the case of a patient, 51 years old, with strictly paroxysmal atrial fibrillation. Our preferred treatment strategy in this group of patients is the cryoballoon catheter ablation. But before we start with cryoballoon catheter ablation, we need a detailed knowledge about the anatomy of the left atrium and the pulmonary veins. So the first step we are going to do is a rotational angiography, which will give us a very detailed insight into the specific anatomy.
Usually at the door Ecuador in the eat more in the commonly in the fall in the people at the hill and the older at the bow in the count and also on the bone in the family and the people in the weak work accident and the hypermark and the show of the hair the sacks and the heart family and the hair defects and the forward at the hour increasing and the rate of the developing of the blood fibrillation.
Good afternoon. Welcome to Grand Rounds. Please remember to sign the attendance record at the back of the auditorium, and also please fill out your program evaluations. And as I generally do, I will request that if you have any ideas in regards to future topics or future speakers, the CME committee is always very appreciative of those. Today it's my pleasure to introduce Dr. Denise Sorrentino. Dr. Sorrentino is board certified in both cardiology and electrophysiology, having done her fellowships in both at Emory in Atlanta. And she has kindly accepted the CME committee's invitation to provide us with an update on a problem that I see on several times a day basis, actually. And please welcome Dr. Denise Sorrentino.
Thank you. Hello, and thank you. Thank you for coming. When I got the invitation to do atrial fibrillation as a topic, I don't never know how an audience will accept that. As Dr. Hallberg said, this is one of those common bread and butter topics that physicians in all specialties see. No one's not included, including the pediatricians. They have patients with atrial fibrillation as well. And the treatment for it is still in evolution. It's a disease that's been around, of course, forever. And we're still really working on treatment options. So today, I hope to give everyone an overview where we're at with atrial fibrillation, where we're going, and all the options available. I believe truly, since the very late 90s,
Conclusion: there are fibrillation in this causing and the very the normal and the totality electrical impulse in the hair at the of the damage in order at the whole hair condition.
Atrial fibrillation is the most common heart rhythm abnormality, and it results in the upper chamber of your heart beating extremely fast, 500, 600 beats a minute. This causes an irregular, rapid heartbeat. It's very much of an age-related problem. It's rare before 50. By the time you're 80, 1 in 10 people have AFib. It's also more common if you have other types of heart disease, if you're very obese. Sometimes it runs in families. So it's a very common, important problem affecting about over 5 million adults in the United States. Diagnosis of atrial fibrillation is by obtaining an EKG, which will document atrial fibrillation. And so this is something that your internal medicine doctor may do, may be picked up incidentally when you're getting a routine checkup, or you may have symptoms. Your heart may be racing, you may feel fatigued, know that something's not right. An EKG is obtained, and you're told you have atrial fibrillation. The first thing we think about with atrial fibrillation is stroke risk, because one of the most devastating complications of atrial fibrillation is having a stroke, which can change your life forever or even kill you. So that's the most important management question. Different patients have different risks of stroke. Some have high risk of stroke, some have low risk of stroke. But if you have atrial fibrillation, your stroke risk on average is 5-fold increased. So there's a number of different treatments we can do to lower that risk of stroke, and that's the most important treatment strategy. We also think about medications to control the atrial fibrillation, or procedures to cauterize the atrial fibrillation, and there's other medications just to slow it down. So it's a conversation that you'll have to have with your physician if you're diagnosed with this condition. Atrial fibrillation on average increases your stroke risk